In this training, we will cover veterinary-specific information for using radioactive materials and X-rays. First, we will go over radiation safety when using radiation-generating machines. We touched on some basic regulatory information in the first training about using radioactive materials. In Missouri, the state regulates the use of radiation-generating machines, not the NRC. You can find more information about these requirements on the Department of Health and Senior Services website. Radiation-generating machines, or RGMs, are equipment that can produce ionizing radiation when turned on. The most common form of RGM produces X-rays. However, linear accelerators fall into this category too. It is an important distinction to note that RGMs do not make the patient radioactive. In the image on your screen, you can see a patient is receiving a PET CT scan. The CT portion of the instrument produces X-rays and is considered an RGM. The PET CT is not producing X-rays when it is turned off. When working with RGMs, there are two sources of exposure. The first is from the primary radiation, which is radiation emitted directly from the equipment. The other source of exposure is from secondary radiation. Secondary radiation can be broken down into two types: leakage and patient scatter. Leakage is from the X-ray tube and can occur if there are issues with the tube housing. This is generally not a concern, especially because state-required equipment inspections verify no leakage is occurring. Patient scatter is the other type of secondary radiation. It occurs when the primary beam scatters off the patient. It is the primary source of exposure to X-ray workers in veterinary medicine, especially because vet med workers often have to hold the patients during procedures. In general, when working with RGMs, remember the following. Always wear lead. This includes thyroid shields, a lead apron, and leaded gloves if you have to hold the patient. Never put your hand in the primary beam, even if you are wearing leaded gloves. Use sedation and restraints as needed to minimize or even eliminate the need for you to hold on to the patient. Collimate the beam when possible. This will help to minimize scatter. When using a C-arm, stand on the side of the image receptor if possible and stand behind shielding. Always wear your collar dosimeters and wear them on the outside of your lead on your collar. The principles of ALARA still apply, so utilize time, distance, and shielding. Standing in a control room is a great example of utilizing this and minimizing your dose. If you must wear lead aprons, inspect them for holes or tears and avoid folding or creasing them. When working in radiation therapy, you will most likely be using a linear accelerator, or LINAC for short. LINACs are a type of RGM. They do not make the patient radioactive. Because LINACs are so energetic, you should never remain in the vault when the beam is on. Let's go over an example of how to implement these general practices in veterinary medicine. Here we have a French bulldog that is undergoing a swallow study. In the picture, you can see the worker is following several different general safety practices, including wearing proper PPE such as lead, using a standing shield, standing as far back as possible by utilizing a constraint mechanism rather than holding the dog, and standing on the side of the image receptor to avoid the primary beam. Now let's go over general safety practices when working with radioactive materials in veterinary medicine. One area you will become familiar with when working with RAM in the vet school is the radiation isolation suite, often referred to as RAD-ISO. Patients injected with RAM will remain radioactive for several days to weeks. When they are injected with radiopharmaceuticals that have relatively long half-lives, such as iodine-131, then the patient will need to remain on-site before they can be released to their owners. This allows for the patient's health to be monitored, and it also allows the patient to excrete significant quantities of RAM, which will ultimately lower the dose their owner may receive from interacting with the patient. When this occurs, the patient will stay in RAD-ISO. This room is unique to Mizzou and has some special features. All the dog runs have drains that are connected to tanks that hold liquid waste. The liquid waste is held for a specific amount of time to allow for the RAM to decay to essentially background or zero. Once it's decayed, the tanks can be released as non-rad waste to the sanitary sewers. This room is also where iodine-131 is injected into patients. Because of the procedures performed here, there's often a high chance that contamination will be present, so special PPE must be considered. When entering RAD ISO, there are certain PPE requirements depending on the task you're performing. If you are entering the room only to perform tasks such as surveying and swiping the area, then shoe covers and gloves are required. If you are performing any tasks that require handling an animal or a radioactive dose, you will also need to wear a second set of gloves as well as a gown. Sometimes you may need additional PPE like a face shield. Before entering RAD ISO for the first time, you will need to receive additional instructions from specific radiology staff. When you leave RAD ISO, you must be careful to remove your PPE, making sure not to step your potentially contaminated booties outside of the room past the yellow and red line on the floor like you can see on your screen. There will be a RAD trash can just on the inside of RAD ISO where you can dispose of your PPE. Once you have crossed over the line and into the anteroom, which is a room outside of RAD ISO, you will need to survey at minimum your hands and feet to verify no contamination is present. Depending on what you are doing in the room, you may wish to perform more in-depth personnel surveys, such as surveying your arms, legs, or even hair. The anteroom is where you can don PPE to enter RAD ISO, and is also where some RAM deliveries occur. Whenever you enter RAD ISO, you must always wear your dosimetry, and remember to never remove anything. Before entering RAD ISO, make sure to check the door leading to the room. If there is a patient being housed in the dog runs, then there will be a posting with information on the patient, including what radionuclides they were injected with and when the procedure occurred. The patients will remain in radiation isolation until their dose rates are low enough that it is acceptable for them to be released to their owners without giving the owner a significant dose over the regulatory limits. Note that even when patients are released, they are still slightly radioactive. Next to RAD ISO is the PET suite. PET stands for positron emission tomography. In the PET suite at the Veterinary Healthcare Center, there is a PET CT scanner. We discussed the PET CT in the X-ray portion of this training. The PET CT has the ability to produce X-rays. However, it can also measure any emissions from injecting a patient with radiopharmaceuticals. Typically, radionuclides used for PET diagnostic imaging are much shorter than those used for therapeutic applications. A common radionuclide used in PET imaging is fluorine-18, which has a half-life of around 2 hours. Because the contamination risk is much lower for PET imaging radiopharmaceuticals, there's not a shoe cover requirement in this space. However, typical lab PPE must be worn. In the back of the PET suite are some dog runs that are similar to the runs in RAD ISO. The same rules apply here, including PPE requirement. Any doses for PET applications are prepared in the hot lab in this room. You may also see radioactive materials used in the nuclear medicine suite. The most common procedure performed in this room is imaging patients using technetium-99m, which has a short half-life of 6 hours. Once the patient is injected, they are imaged using a gamma camera, which you can see in the image on the left. The gamma camera does not emit radiation. It only detects the radiation being emitted from the patient. Doses are typically injected in this room, in RAD ISO, or in the stalls, depending on the patient. When the room is being used for imaging, standard PPE, including shoe covers, is required. After a procedure is complete, a survey of the room is done to ensure no contamination is present so that shoe covers do not have to be worn. Sometimes less traditional rooms may be used for RAM procedures, including stalls or the ICU. When this occurs, signage will be temporarily posted and access will be restricted using things like stanchions or carts. When entering these areas, shoe covers will be worn. In horse stalls, bedding will be double packed to soak up any radioactive urine. When the patient is released back to the owner, the area will be decontaminated and surveyed to ensure no contamination is present before releasing the room or the space as a non-RAD area. There are other areas in the Veterinary Healthcare Center where RAM may be used even though the room is not posted as a radiation lab. Sometimes patients will undergo RAM procedures in a radiation lab and then be transported to another area of the hospital, such as CT or angiography. Patients could also be directly injected while in these rooms. Spaces like this are considered transitory use areas and will be surveyed after the procedure is complete to ensure no contamination is present. So when are patients no longer radioactive? Patients will be radioactive immediately after they are injected with any radiopharmaceuticals or undergo other RAM procedures. RAM will leave the body by two mechanisms: radioactive decay and biological elimination. Because of this, the patient's excreta, including saliva, will also be radioactive. This is why it's important to wear proper PPE when handling animals after RAM procedures. The patients will no longer be radioactive after 10 half-lives of the radionuclide have passed. However, it is impractical to have a patient stay for the full 10 half-lives, especially if they have received a procedure with a longer-lived radionuclide such as iodine-131, which has an 8-day half-life. So MU and the vet radiology staff have developed guidelines for releasing patients to their owners earlier than the 10 half-lives, while also minimizing the dose to their owners and staying compliant with NRC regulations. The radiology staff will release all patients who have undergone RAM procedures. Depending on the type of procedure the patient has received, they will be required to remain in radiation isolation for a specific amount of time. Once that time has passed, a radiology staff member will take a dose rate at 1 meter from the patient using an ion chamber, as you can see on your screen. The radiology staff have a list of dose rates that are acceptable for considering an animal releasable back to their owners or the public. These dose rates are calculated to ensure a member of the public does not exceed their annual limit of 100 millirem. If the patient has been in isolation for the minimum required amount of time, and their dose rate at 1 meter is under the acceptable dose rate limit, then they may be released back to their owners. Upon release, all owners will receive instructions that are tailored to the specific radionuclide administered. The instructions given to the patient's owners include several topics. Methods to keep the owner's dose as low as reasonably achievable would include things like instructions on how to handle patient waste properly or keeping their distance for a certain period. The length of time instructions need to be followed is determined based on the radionuclide and its half-life. Avoiding direct contact can include things like having the patient sit on the owner's lap or sleeping with the patient in the same bed. And avoiding public spaces could mean not taking the patient to the dog park since other members of the public will be present too. Since the owner is considered a member of the public, their dose limit is only 100 millirem annually, which is why it's important that owners follow these instructions. There may be additional topics discussed in the instructions depending on the procedure the patient received. If you recall from part 1 of the training, security of radioactive materials is a top priority. This also applies to security of non-traditional labs where security may not be as straightforward to achieve. For example, horse stalls that are posted as radiation spaces will need to be locked, and any rad waste generated from this should be secured as well. You can find emergency procedures in the anteroom of the radiation isolation suite. Sometimes patients need to return to the veterinary healthcare center either for emergencies or additional testing. This is allowed, however, the PI must be notified. Remember to contact the radiation or radiology staff if any medical emergencies occur while the animal is in rad ISO. In the top picture, you can see the emergency procedures located above the sink in the anteroom and in the isolation area. In the bottom picture, you can see an emergency kit for rad ISO patients that need to be transferred to the ICU. This kit is located in the large X-ray room. We have covered a lot of information in these trainings, so please make sure to seek additional lab-specific training from the radiology staff for any specific actions you will be performing. And as a reminder, RGMs do not make the patient radioactive. The biggest concern when using RGMs is minimizing exposure from scatter radiation, especially when holding the patients. Conversely, when using radioactive materials, remember that they continuously emit radiation, so they will make the patient radioactive for a certain period. The biggest concern with RAM is trying to minimize your exposure and also try to minimize the spread of contamination, especially into unrestricted areas.